It is necessary that the patient have use of at least one leg. If not, you will need to use the lift to transfer the patient. Also, if you are unable to support the patient by yourself, do not attempt to do this because you can injure both yourself and the patient. Wear non-skid shoes and have the patient also in non-skid shoes or socks to reduce the risk of falling. Also, clear the area of loose rugs and secure tubing from oxygen. Be sure to explain the directions to the patient before attempting and repeat each step before you proceed. Put the wheelchair next to the bed. Be sure to lock the brakes and move the footrest out of the way. To assist the patient into a seated position, roll the patient onto the same side of the wheelchair. Put one of your arms under the patient's shoulders and one behind the knees. Bend your knees while you lift and swing the patient's feet off the edge of the bed and use the momentum to help the patient into a sitting position. Move the patient to the edge of the bed and lower the bed so the patient's feet are touching the ground. Before transferring into the wheelchair, have the patient sit on the side of the bed for a while to avoid getting dizzy upon standing. Stand as close as you can to the patient, reach around the chest, and lock your hands behind the patient. Place the patient's outside leg, the one furthest from the wheelchair, between your knee for support. Bend your knees and keep your back straight. Count to 3 out loud and slowly stand up. Use your legs to lift. The patient should help support their weight on their good leg during the transfer. Pivot towards a chair, moving your feet so your back is aligned with your hips. Once the patient's legs are touching the seat of the wheelchair, bend your knees to lower the patient into the seat. At the same time, ask the patient to reach for the chair's armrest. If the patient starts to fall during the transfer, lower the person to the nearest flat surface, bed, chair, or floor. To move the patient from chair to the bed, reverse the directions. If moving from a wheelchair, be sure the wheels are locked and the footrest is out of the way. Bring the wheelchair beside the bed and have the bed lowered to be even with the chair. Make sure the person's strong side is beside the bed. Have the patient put both feet on the floor. Ask the patient to move forward in the wheelchair. Stand in front of the person. Ask them to sit tall, lean forward, and push down on the chair armrest as you help them stand. Place your hands around their upper back. If they have a weak arm, place your arm around it, not under it. Do not pull on the weak arm. Help the person to move their feet until the bottom is over the edge of the bed. Help them sit down. The person should reach for the bed with their hands, bend their knees, and keep shoulders forward. Protect your back from injury by bending your knees while you lift and swing the patient's feet off the edge of the bed and use the momentum to help the patient into the lying position on the bed.